A snapshot of life before COVID for Ottawa mother Brianne Quarrel.
I've had some really rough days with it because I was that close to dying.
Quarrel spent 2 weeks on a ventilator in the spring. COVID caused her hair to fall out. 10 months later, symptoms linger and frustration mounts.
I almost lost my life, but you think it's okay to get together for Christmas? You know, like, really? Are we going to be that selfish?
Tomorrow, Ontario will reveal new modeling showing just how dire the pandemic is. CBC News has learned there could be 6,000 cases a day by month's end, with ICUs overrun by early February.
We are looking at a lot of unnecessary death and human suffering here, not only from patients dying a terrible death with COVID-19, but patients being unable to access other life-saving services.
Tougher measures are coming. There won't be a curfew, but sources say possibilities include another emergency declaration, shorter hours for essential businesses like grocery stores, and limits on construction activity.
We are in a serious situation and serious measures need to be done.
But the only way to quell the crisis, say many doctors and other public health officials, is ensuring paid sick leave for workers and increasing testing at large workplaces.
Workplaces where people are getting COVID-19 and bringing it into their own homes, and they're given poor incentives in terms of, necessarily getting tested, isolation, financial instability.
Tomorrow's modeling will also show many Ontarians are flouting public health guidelines, with a spike in travel in the days before Christmas.
What we're doing right now isn't working, and I think it's really tragic.
31-year-old Amara Posian contracted COVID in May. Some days are still a struggle, she says, with brain fog and fatigue.
You don't want to get it, and you don't want to pass it on.
So the number of people hospitalized, Ellen, this is always a concern. What's Ontario's situation right now?
Well, right now, Adrienne, there are 387 COVID patients in ICUs across the province. 268 of them are on ventilators. And the president of the Ontario Hospital Association, who you heard from in the story, said that if things continue as they are, it is not outlandish to think that Ontario could find itself in the same position as New York or Italy in the first wave of the pandemic. Another sign of just how difficult, how sad this all is, Adrienne, is that today Ontario passed the terrible milestone of more than 5,000 lives lost to COVID-19.
A long road ahead. Ellen, thank you.